Good evening, everyone. This is Dr. Patmos. It is December 8th, 2025, and I want to do a quick video about the recent CDC ACIP recommendation to abandon universal hepatitis B vaccination at birth. For those of you who are not following this, this is a really, really big deal. 3 days ago, the ACIP, the Advisory Committee on Immunization Practices, chaired by Dr. Milhoan, who was in Hawaii, and vice chaired by Dr. Malone, who was there on site, made an unbelievably flawed decision. They voted 8-3 to stop the policy or to not recommend the policy of immunizing all babies at birth for hepatitis B. And the rationale given for that was expressed very articulately by Dr. Malone when he said that there's an elephant in the room. There really isn't, but he said there was an elephant in the room because there's no proof that cumulative vaccines at young ages aren't a risk. There actually is plenty of evidence that they're not a risk. And he also referred to adjuvants such as aluminum, which has also been proven not to be a risk. Nevertheless, because of the argument Dr. Malone made was because there might be a theoretical or hypothetical risk to these vaccines, we should abandon vaccination and only vaccinate in certain situations, but not across the board. This is a terrible decision on biologically because we know, for example, that hepatitis B acquired in the just after birth or at birth occurred at about a rate of about 20,000 cases per year in the United States. Because of this policy enacted in 1991, we brought that down to 80 cases per year. Hepatitis B, if you don't know, is an incurable disease. You can get acute hepatitis, you can get acute fulminant hepatitis and fulminant hepatic necrosis. You can also get chronic hepatitis, which leads to cirrhosis, all the complications of hepatic cirrhosis, and hepatocellular carcinoma, among many other manifestations. Basically, once you get hepatitis B, you pretty much have it for life. It's a bad disease. And to allow babies to get hepatitis B at childbirth when we can prevent it is ridiculous. Those are the biological and medical reasons to oppose this recommendation. But I want to focus on another area, and that is the ethics of this decision. If we just set aside the biology of it and just look at it on the grounds of biomedical ethics and the core principles of biomedical ethics of beneficence, non-maleficence, justice, and autonomy, it fails miserably. This was a this action is wholly, entirely, completely, and grossly unethical. It's an unethical action. Also, the way it was conducted was unethical, but that's procedural ethics. I'm talking about just the core bioethics of a decision to withdraw a vaccine that we know has enormous benefit and is safe. We've known this for 30 years because of a theoretical, hypothetical risk for which you have no evidence. So withdrawing something good that's providing benefit over a hypothetical risk of harm for which you have no evidence is a net harm. That fails the ethics test. I'm going to say this really clearly. The CDC, ACIP just committed professional, medical, ethical misconduct. This is professional misconduct on the part of the members of the ACIP meeting. If they're licensed physicians and they endorse this, they are guilty of unprofessional conduct. This is unethical. And I would like to see somebody talk about the ethics of this decision other than myself. I'm not an ethics expert. Dr. Art Kaplan, I hope will see this and hopefully he'll comment, but this is flagrantly unethical. And the doctors who signed off on this should be ashamed, and worse, they should be written up for unprofessional conduct.